Why are absence seizures hard to detect in kids? Imagine watching a child in class and suddenly they stop what they are doing, stare blankly for a few seconds, and then carry on like nothing happened. It might seem like they are just daydreaming or not paying attention. That's often how absence seizures appear in children. These seizures are tricky to spot because they involve very brief and subtle changes in awareness without any dramatic movements. Unlike seizures that cause shaking or falling, absence seizures usually just cause a quick lapse in consciousness that lasts only about 10 to 15 seconds. During these moments, children might stare blankly, have tiny fluttering, blink repeatedly, or make minor movements like lip smacking or slight hand fidgeting. These signs are so subtle that they can easily be mistaken for normal childhood behaviors like daydreaming or being inattentive. Another reason these seizures are hard to detect is because they start and end suddenly. They happen quickly and without warning, making it easy to miss unless someone is watching very carefully. Since there are no convulsions or dramatic physical signs, it's not obvious that a seizure is happening. This can lead to confusion, especially because the signs resemble attention problems or behavioral issues, such as those seen in attention deficit hyperactivity disorder. Children with absence seizures might have multiple episodes throughout the day, but each one is so brief that parents, teachers, or caregivers might not notice or might think the child is just distracted. Sometimes, these seizures include very subtle automatisms, which are involuntary repetitive movements like lip smacking or hand movements. These are not always obvious unless a doctor specifically looks for them. To confirm if a child is having absence seizures, doctors often use an electroencephalogram, or EEG, which records brain activity. During the test, certain patterns in brain waves can indicate the presence of absence epilepsy. However, since the seizures are so brief and subtle, they can be missed without this specialized testing. Because of all these factors, absence seizures often go unnoticed or are mistaken for normal behavior. This delay in diagnosis can affect treatment and management. That's why awareness of these subtle signs is so important. Recognizing that brief lapses in attention might be seizures helps ensure children get the right diagnosis and care. If you suspect your child might be experiencing these episodes, it is essential to consult a healthcare professional who can perform the appropriate tests and provide guidance. Remember, each child's experience with epilepsy can be different, so personalized medical advice is always the best course of action.